I think the most important thing is awareness. If you don't know that this condition exists and you don't know how to diagnose them, you pretty much are not going to get anywhere. And I think the most important part of my talk today, the talk I gave, was to say that hematological predispositions present as common conditions. Your child who comes into A&E with ITP, your 7-year-old child, 8-year-old child referred to you in clinic with a possible aplastic anemia, a child who comes to your inpatient ward with acute myeloid leukemia. These are all common hematological diseases, but underpinning that, all of these children I've described have all been later identified to have germline predispositions to leukemia. So I think the key message to, as an expert and along with a lot of other collaborators across the UK for a national study that we're running, it's a national observational study for pediatric germline predisposition syndromes, is to say we want to improve the awareness of clinicians who are at the front line that 6 to about 20% of your patients with common conditions will have germline predispositions, and we want them to reach out to centers of expertise. What we will then receive at the centers of expertise, which would be a network of centers, would be well-annotated clinical cohorts of patients. We can then engage with pharma companies to say, here's a well-annotated cohort, this is what we know about these patients, they need better treatments. What you don't want is orphan diseases, orphan drugs, and just us knowing a lot of information about the disease but not being able to do very much about it. So I hope that the key message out there is improve awareness and engage with centers of expertise.